is set up okay. All right. Well, without further ado, welcome in if you haven't been here before. My name is Dr. Matt. I've been an MCAT tutor and pre-med med school admissions coach for over a decade, and I really enjoy helping people get into med school and on their way to that white coat. So if you have any questions, drop them here in the comments. Let me make sure we are set up on the YouTube site as well. Ask your MCAT and Premed plus med school questions here. Talk about admissions and more. All right, and let's go ahead and leave that here as well. Welcome in. Ask your MCAT and Premed / med school admission questions here. All right. Okay, so we will kind of kick off like we normally do with a few sort of general purpose, general information things. If you are brand new to the medical school process, right? So a couple things, sort of really basic background stuff you should know is that if you are on the U.S. med school track, you are essentially looking at a process of around 4 years of undergrad. That's regular college, followed by about 4 years of grad school, which of course is med school. And if you're on the journey to going through a traditional MD program or a DO program, usually somewhere between 1 and 2 years of that is going to be preclinical, which is where you learn about the science of the human body and the science of disease, followed by about 2 to 3 years of your clinical rotations, where you're going to learn about all of the wonderful ways that we diagnose and triage and treat all the different things that can go wrong with human health. And of course, we also talk about, in med school, we also talk about how to do preventative care to some degree, right? Like we don't do a lot of preventative care in our current medical system, but we should probably do more, right? All right, let me see if I can adjust my camera here on this side. I'm not entirely sure what setting I have this thing on. Oh, I think I figured it out. Let me see. What is this? Center versus center. It is centered. I wonder if any of you guys are expert enough at the way that TikTok floats the camera to let me know how exactly, why exactly it does this very interesting thing with the camera zoom. Not sure what it's doing there. All right, let's see what we can do on this side. Effects. Is an effect on? How do I know if an effect is on? I don't know. No effects. There's some kind of zooming thing seems to be going on. Anyway, we'll figure that out later. Drop those questions in, guys. Let's see. Let's go through. We'll go ahead and pull up our favorite list of. I'll go ahead and pull up our favorite list of questions most frequently asked about the MCAT. And what I'm going to do is, instead of rocking and rolling with whatever the sort of standard answers are, I'm going to give you the perspective of, someone who's been doing this a while. All right. We have a question from I Am Not Real. Asking, how do I make my application unique? So thank you for the question. That's a great question. And it's a real, in fact, this is probably something that is worth saving here. But yeah, the How do I do the record rant? Oh, yay. Awesome. So the question is, how do I make my med school application unique? And it's a really good question because let's face it, everybody has to check off essentially the same set of prerequisite courses, take the same entrance exam, that's the MCAT, complete certain steps, get certain letters of recommendation. And in the end, it can feel like you're checking off the same standardized list that everybody else is checking off. And you don't want to be the same standard applicant as everybody else. So one of the most important things that you can do is to write a really unique personal statement essay that presents who you are and the challenges that you've overcome and the things that you're passionate about in a way that only you could have written it, in a way that only you could be reflecting on who you are as a person. The other thing that you can bring is that in the volunteering, even though a lot of the volunteering is very standardized for med school applications, you can specifically do things outside of the usual sort of roster of volunteer activities that reflect what you're passionate about, whether that means the community you're serving is somebody you really care about serving, or the project you're working on is something that you care about a lot. Those are a couple of really great ways to sort of customize the application. And then the last one is that you don't have to do a regular major that all the other pre-med majors are doing. You can study whatever you like. So if you're interested in, say, women's studies or medieval history, or if you're interested in fish and you want to do ichthyology, or if you're interested in zoology or whatever it is, do your thing, study what you're interested in, and don't worry about only checking off the list that everybody else is checking off. All right, guys, I hope that's helpful. Let me see what our next question is here. All right, next one's PK says, can higher MCAT make up for lower GPA? And the answer is yes, a higher MCAT frequently can help you with the GPA. The kind of upper limit is once you get down below like a 2.9, like if you're talking about a lower GPA, at that point, you almost cannot break even no matter how good you are on the MCAT. Like you could get close to like a perfect MCAT score. And if you're coming in with like a 2.3 GPA, I'm sorry for the bad news, but it's probably not going to help. But provided that you have like a moderately low GPA, like say a 3.2 instead of a 3.8 or something, then yeah, it totally can. If you want to talk more numbers, let me know, but you definitely can. It's one of the reasons why I tell students, once you're more than like 3 years into your undergrad, if you don't have the GPA you want, your best bet is going to be to work hard on the MCAT, because jumping to a higher MCAT will jump your percentage of acceptance more and faster than doing something like, say, taking another dozen or 24 hours and just trying to slowly inch the GPA higher. Taylor says, how long did you study for your MCAT? So I very, very, very much believe in like practice what you preach when it comes to test prep. So I tell a lot of my students, if they want the highest possible MCAT score, that they should plan to put in at least around like 6 to 9 months. And so I actually did that. I kind of had an idea of when I wanted to take the MCAT, and I wanted to take it with enough time in case I needed to retake it. And thankfully I didn't have to, but my first few practice tests were terrible. And I put in that like around 9 months of study time. I did thousands of practice problems. I developed my own ladder method, and I went from having a very, 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 very low first practice MCAT score up to my final and official practice test score, where I scored 90th percentile and was able to pull 100th percentile on physics and chemistry and cars. And so it's doable. It's possible to make really huge improvements on your score, provided you're methodical, provided you learn the test, not just assume that it's about content knowledge, because part of it is definitely not. And then figure out what the what the thing is that's actually taking away your points. And once you can do that, you can figure out how to outsmart the test. But what you can't typically do is figure out all those separate things in a matter of a couple weeks, because a lot of students, they kind of have an idea about when they want to take the MCAT, and then somewhere like 4 to 6 weeks before, they Google how to study for the MCAT in 4 to 6 weeks. And unfortunately, it just is not enough time. Like it's just not enough time. The 4 to 6 weeks time period is something where if you want to improve a few techniques and fill in a few content gaps, you could do that. But if you want to max out all the sort of separate skill sets that you need to get a really high score, you're just going to have to pick between them. You're not going to have a chance to do all of it. Next one says, any thoughts on the SAT? All right. So if you're still a high school student and you're thinking about doing med school, the thing you need to figure out is, am I taking this SAT to blow the minds of a college application, or am I taking the SAT to also do a pipeline program? So if you're trying to get into a BS/DO or a BS/MD, where it's a bachelor's pipeline into a medical doctorate, those are very different things that you need to be thinking about, and the kind of cutoffs that you need to be thinking about will end up being pretty different. Now, in terms of SAT prep, I personally think that the idea of doing a very, very, very practice intense sort of ladder method approach is also very good. I still take on a few SAT students per year. You can drop me a line at matt@mcatboss.com if you need help with your SAT prep. But I do push students very, very hard, because I usually am only helping students who are like gunning for like Ivy League schools. And you really, really, really have to be pretty aggressive now with how much test prep material is freely available online. There's no excuse to simply not having enough material. Like back in the 90s, people could run into the problem of just like not having enough material to practice. And nowadays, there's plenty of material. So you really have to bring it. All right. Okay. So next one is a really good question. So the next question is asking, not directly MCAT related, but asking how you would know if you are really passionate about becoming a doctor. Like, how do you tell if it's your dream and that you're not sort of doing it for your parents or for somebody else? And the answer, I think, can kind of come from two different things. One is you really want to make sure that you are spending a lot of time. Thank you guys for tapping the like button. Let's go crazy on that like button and help a few more pre-meds to find us and come over and talk about getting into med school. The overwhelming reality is that you're going to be in med school with people who never actually checked if they wanted to become a doctor. And you're going to be in med school with people who really know they want to become a doctor. And then you're going to be in school with a bunch of people who might never truly sort of tackle which is which. And personally, some of us who are like career changers, because again, I was not one of those people who's pressured by parents to get into medicine. I had a different career, and then I pivoted as an adult. And your decision to do it when it's informed by other sort of life choices and when you're older, I think can give you a really, really good opportunity to discuss these very unique insights about life and goals and medicine on your personal statement. It's going to be hard to write an essay like that if you haven't yet figured out whether you want to. And I encourage you, if you're not sure, spend a lot of time with doctors in clinics and hospital settings until you can elucidate in your own words whether the scenario, the daily experience, the interaction with patients is the set of things that you want to be experiencing and living on a daily basis. And if you get there, that's great. And if you don't, it maybe can be that you haven't found the specialty that you're wanting to work in. And if you really, truly just don't enjoy it at all and it feels very tedious, then, it's okay to recognize if it is not for you. Okay, next one was, did you take it? What did you get? I think this is relating. I do think that question was relating to the SAT. Yes. I scored in the 1400s. All I remember was it was 90 something percentile. It has been a really long time since I took the SAT. But I did do well on it. Somebody says I'll be honest. I have a 3.9 GPA, a 3.8 SGPA, and I got a 500 on the MCAT. Do I retake? Okay. So, for the question asking about the specific score bracket, I do always try to make sure that when I get asked about that, we actually go off of the real answer, the real grid. So rather than sort of spitballing it, we're going to go to the MCAT GPA AAMC grid. I do encourage anybody who doesn't have a very clear grasp on kind of what admissions numbers look like, to take a moment and actually open that up. If you have not ever opened that up, it is freely available. There's no charge for it. It is the AAMC MCAT GPA grid, and the current most recent one, I want to say it was from, let's see, admissions data through 2024. So it is fairly recent. And for an overall GPA above 3.8, a 500 has an average acceptance rate of 28.9%. So to put this into context, for a lot of people, that will probably sound incredibly not good, because that's over a 70% chance of not getting in. The thing to keep in mind is that the average acceptance rate in the US to MD schools is around 40%. So you already have around a 60% rejection rate on average, period, across the board. So that 70% rejection rate is not actually that much higher. Now, mind you, the thing that you want to keep in mind is, even if you can't change your GPA at this point and you have a good GPA, there's nothing at all wrong with your GPA. It's actually higher than my GPA was, and I got accepted into almost every med school I applied to. Mind you, I had a really, really good MCAT score, and if you jump your MCAT score just up into that like 504 range, you're looking at actually getting up to that national average of around 40% acceptance. If you can jump it up into that 508 range, you're looking at more like a 52% acceptance rate. And if you can jump it up into the 512 range, you're looking at almost a 70% acceptance rate. So it's oftentimes it's worth getting getting that MCAT score higher. So in my opinion, I would say unless you are planning on applying to DO, and there's nothing wrong with that at all. DOs are wonderful. Lots of colleagues who are incredible doctors who are DOs. If you're planning on applying MD, you probably do want to take that. Take that retake. Let me see something real quick. Just a real quick point out here, guys. I'm the founder of MCATboss.com. I will take this off the screen in just a second. But this middle one here, the exam taker retaker guidance, that is my most popular thing that like every single year that books out on MCATboss.com is people retaking. If you want somebody to push you really, really hard, drop me a line, MCATboss.com, and let's talk. Taylor says, do you think multiple charity 5Ks could look good as extracurricular on resume besides clinical volunteer, etc., that will be on a resume? A couple things here. There are there are kind of a couple aspects, right? Like there are social aspects, there are charity aspects, there are sort of the unique, what is the student's passion aspect? How much of this will be carried into your essays? How much of this will be carried into your conversations? If it can inform any of those things, I think it is absolutely valuable. I think if it is something you do regularly enough to make it a conversation starter, if this is my jam, I love doing charity 5Ks, then I think it can be a distinguishing factor. Now, if this is something you have not started and you're deciding, hey, is this my best use of time? That's a very, very different conversation. So if you have deficits in, for example, like clinical hours, like if you're like, man, I only have 13 clinical hours, or I only have 45 clinical hours, and you want to get it up to a couple hundred, then replacing those with charity 5Ks would not be a good move. If you're already good to go on sort of the medical volunteering side, yay, thank you for helping us get over 1,000 likes, guys. Then I would say, you know what, more power to you. Go for it. Absolutely go for it. All right. Next one says, can you compare med school to undergrad and try to explain the difficulty difference? Yes, this is a great question. So in fact, this is worthy of recording as another sort of postable rant. So what is the difference between difficulty of undergrad, say a science degree, and the preclinical sciences in medical school? So the first year or two of med school. And the difference is actually not huge in terms of the conceptual difficulty. But the amount of material that you will learn in a 1 or 2 year preclinical portion of your medical doctorate is so much more intense than the most intense undergraduate science degree. You will be studying night and day. You will be listening to lectures and then cramming information into your brain and then taking what feels like a compounded final exam every few weeks, and you'll blink and then you'll have more, and you'll blink and you'll have more. And you're essentially never allowed to forget any of that, because at the end of all of this, in a year to year and a half into your preclinicals, you then have your first board exams where you will then sit for a full day exam where you have to still remember all of the stuff that you just crammed into your brain. So it is not harder than undergrad, but it is very, 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 very intense. And there's no amount, since we're in the AI era, there's no amount of AI that will be able to answer questions for you when you're sitting in your board exam. So make sure your brain is picking up the information. All right. I hope that was helpful. Next one, let's see, says... and welcome in, guys. Let me just reintroduce real quick, guys. If you are new here, my name is Matt, and I am an MD with distinction in research, and I am the founder of MCATboss.com. You can always drop a line at MCATboss.com. You can always email me directly, matt@MCATboss.com, if you are looking for help ratcheting up your score. If you need to figure out why you need to retake the MCAT, you can find me there. And let's keep going on some questions. Next one says, I watched a lot of House and Grey's Anatomy. I'll be fine. Yep. You know what? Go for it. That'll do you. All right. Why it says, for pre-med, should I go to Tennessee to save money and keep my GPA up, or to Emory? Tennessee is a state school. Okay. So that is a very complicated question. I sometimes tell students sort of very nonchalantly that it doesn't really matter what undergrad you go to. But one thing that I think I want to be more sort of careful about going forward is reminding students that you're not just getting classes, prerequisites, grades. You're also getting relationships with people who are leaders in their field. And if your option is to go to a school where you are not going to talk to anybody, or where you're going to talk to people who aren't leaders in their field, then it might not matter that much. But if you're going to go to a school and actually befriend the professors and actually like talk to people and get to know them, then picking a school where you either have smaller classes and you can get to know people, or picking a school where the professors will make time to talk with you, I think that can be something that you should probably think about. And unfortunately, I can't distinguish for you whether a state school or a kind of posh private school like Emory will be better for that, because there are very posh private schools where students actually don't have very much access to their professors, and conversations with their professors don't lead to recommendations. And then there are other very posh private schools where students have a lot of access and a lot of conversations and life-altering, permanent, long-term professional collaboration with the professors. And so I really think that is something you should navigate with that in mind. And I won't make a particular recommendation for you, but let us know what you decide. Next one says, I'm a sophomore and I'm terrified of the MCAT. I don't know what to do or think. It gives me anxiety. Okay, so I think this is actually, thank you for the comment, by the way. I think this is a reasonably common feeling that people have. It can feel like, it can almost feel like somebody's like, hey, you're going to have to train. You're going to train for like a crazy ultra marathon. Like I have a former MCAT student who's now very successful med student, hopefully on his way to becoming a brain surgeon, who is a ultra marathoner, right? Regularly runs 100, 110, 120 mile runs. It can be a little bit like telling somebody you're going to run a 100-mile race next summer, and the person has just like never done anything more than gone for a walk or jogged by a lake. And it can be very intense if you don't really know what the steps are to get there. So I think it's probably a good idea, Elena. I think it's probably a good idea to break the mystery of the MCAT down a little bit, get to know a little bit about it, read a little bit about it, maybe take a free practice test slowly over a couple of days and just kind of get used to how it feels as a test, because it really is weird. It's a very weird contextual exam that most people are just not used to, because it's not direct recall. Like it's not a set of, did you know that the powerhouse of the cell is the mitochondria? Like it's not like that. Like it's not a series of factual recalls. And you want to get used to it, and then you need to actually scope out, how am I going to prepare for this? If you need help on that, drop me a line at mcatboss.com. But generally speaking, make sure you are planning almost a year in advance if you can. Eduardo says, how do you go about finding clinical volunteer hours? Honestly, you just have conversations with a bunch of different clinics and a bunch of different doctors, and you see who's cool and who is open to letting you volunteer, who's cool with having you shadow, and you get started and you go for it. Taylor says, do you have any opinions on U of M medical school? You might have to be more specific on which of the M's you're referring to there. Crimson says, I tested after 2 weeks study, did bad with the 491. Yes, Crimson, for sure. 2 weeks of study, I don't think is like even close to a reasonable chance that you're giving yourself of doing your best. I think you want to be planning on quite a lot longer prep time. I do not know how to, I don't know how to summarize that in like a shorter way, but I would never go and take it. Oh, University of Michigan. I don't. So I'll be completely honest. I have had countless students over the past like 13 years of doing this, and I cannot tell you I've ever had a student go there. So I don't want to give you, Taylor, I don't want to give you an opinion based on hearsay. So I'm gonna pass on. I'm going to pass on giving any kind of opinionated answer about a particular or like regional or state school, because that is one that I don't have. I know for a fact I've had a bunch of students who've included that when they're throwing the broad net of like 3 to 4 dozen schools that they're applying to. I cannot say any of them have chosen that school and then gone there and given me feedback. So I don't want to bias you for or against. All right. Next one says, next question was, did you work while in med school? I actually did. I have been a med school admissions coach and a MCAT tutor, and helped run another company as well. And I'm not necessarily going to recommend it. It's a lot of work. Next one says, is this a career for someone who finds fulfillment in translating difficult topics while helping? Like as in, I used to be a tutor and loved it, but want to practice medicine. I'm so sorry. I'm not entirely sure what your question is. Are you asking kind of how the teaching role translates to the practice of medicine? Please feel free to just kind of clarify your question. I don't want to answer something you're not asking. Next one says, how would you rank based on difficulty, the MCAT step 1, step 2? I think that the MCAT is uniquely broad. I think the biggest challenge with the MCAT is that the MCAT is just absolutely insanely broad. It's so I think step 2 is the best exam. And I say this having obviously, most recently taken step 2, just because that is the last one that that's the last boards you take when you are finishing med school. So of those 3, that would be my most recent one. The MCAT, obviously, I have been eating and breathing and teaching for over a decade. But I respect the fact that the MCAT is, and probably will continue to be, one of the most shockingly broad exams in existence for just in terms of like, what other exam are you going to take where they're going to ask you about Piaget's developmental theories and also ask you about something like the Doppler effect, and also ask you about the Michaelis-Menten dynamics in chemistry, and also ask you about the biochemistry of amino acids, like there's, and also ask you about reading comprehension while you read about Aristotle and Plato and how much they did or didn't like other philosophers in ancient Greece. Like there really truly isn't another test that is that broad. Step 1 is an awesome test. Step 1 is like straight up pure everything you need to know about the science of the human body and human cells. I think step 1 is a blast. I think a lot of students have a hard time with step 1 because you're just really busy when you're taking it. And so you may not have a lot of time. It's not like the MCAT where you can like be like, hey, I'm going to take the MCAT in a year or 2 and I'm going to go ahead and study for it. So I think, man, I think step 1 is awesome though, because it's just so relevant. Like it's such a refreshing thing to not, it is just such a refreshing thing to not have to worry about all the other random stuff that doesn't apply. Let me see here. Somebody says, Crimson says, you had told me to push it back because my full length was 43. I tested and now regret it. Okay. Yeah, no. So that's definitely a confirmation for everybody in the audience that, it really truly is a thing when a really experienced, MCAT teacher is emphasizing how important it is to actually prep before you take an official exam, and then you go ahead and take it off, take it in a couple of weeks anyway, that you maybe should reconsider. So yeah, my recommendation is always that if you're not scoring at least within like 3 to 5 points of your ideal score, then I really strongly, I super strongly recommend going ahead and sticking to your study schedule and then rescheduling and actually putting in the few months to get that score up. Honestly says, high school senior, when should I start studying for the MCAT? Definitely not right now. Right now you need to be focused on getting into a good college. And then your first 2 years of college, you need to just make sure you absolutely ace your prerequisite sciences. And then at the end of your second year, you can plan out about a 9 months or so to go ahead and take your MCAT so that by the time you're in the middle of your third year, you can be taking it. Taylor says, my parents and grandparents didn't attend college. Could that be something I talk about in med resume? Yeah. So Taylor, if you're a first generation, because this is my experience as well. If you're a first generation doctor, if you're a first generation med student, it can genuinely be something unique because a lot of the people who are applying to med school are coming from medical families. They're coming from 1 or 2 doctor homes. Sometimes, I had classmates in med school who were 3rd through 5th generation doctors. They're like, yeah, my dad and my granddad and my great granddad were all doctors. I had one really awesome clinical professor in medical school who was a really talented physician, but essentially parts of the hospital were named after people in his family because they were like they were like a medical dynasty, right? Like the dynasty of medical education. Like, it gives you a really, really significant sort of heads up on preparation when you know the ropes, when you have people who know the ropes, when you have people who are like, you know what, the person you need to talk to is this person. The person who's going to write you a recommendation is this guy who I used to work with. And I'm going to let you come in to this guy's clinic and that guy's clinic, and I'm going to tell this other doctor to have you in there. Like, it really is dramatically different if you have the experience of coming in as like a first generation. Next question says, being a physician in general, do you think building relations with patients would show parallels to the fulfillment of being able to translate hard topics to those who don't understand? Yes. So that is a complicated, that's a little bit of a complicated question. And guys, we are going to wrap up here in probably about 5 minutes. So any other questions you have, drop them here. But yes, the question about translating hard topics, it really truly does depend on, and let me leave my text here for a second so everybody knows. You can find me at mcatboss.com. Let me do a text wrap here. I'm not sure. Let's see. Text shadow. Is that what I need? No, that's not what I need. Custom text box. Maybe that'll happen. I wonder if that will work. Apply. Does that do anything? That does not. Okay. Huh. Okay. Well, nonetheless. But yes, the bottom line is that you will have some particularly interesting experiences as a physician, as a med student initially, where if you really enjoy teaching, if you really enjoy explaining, you will have the chance to teach, you'll have the chance to explain. And in some cases, it can make a really big difference for people, right? Like, it can make an enormous, in some cases, a life-changing difference to be able to have those conversations and talk with people. I have a really poignant example of this that I witnessed where a couple of really poignant examples where people had essentially been confused by stuff they had heard about certain treatment options for very serious illnesses and decided against having a particular diagnostic or therapeutic intervention, and where the provider, the med student or the resident, was able to talk with them, figure out what exactly was the hindrance, right? What was the thing that was keeping them from wanting to get the care that was recommended. And when they were able to get those questions answered, they actually were very interested in having the intervention, and they didn't know that it was safe, or they didn't know what the intervention was, and not knowing scared them. And in some cases, people come in and they're deeply confused, like deeply, deeply, deeply confused by the internet misinformation that they have been given through various internet searches or through interactions with AI or whatever. And it can be really, really helpful to be able to just calmly discuss this with a provider who's able to explain it. So yeah, no, mind you, not every single specialty is very prone to having that kind of explanatory relationship. Some of them you won't be doing this almost at all, like anesthesiology. You probably aren't going to be explaining a lot of stuff. You're going to, a lot of your procedures might be going in and getting someone to kind of calmly go to sleep during a procedure and then getting them awake again after. And it's not the same. Next one says how it impacted me, or is that overused in resumes? No, as long as you word it uniquely for yourself and you tell your own story and don't depend on it being a stereotype, then it's absolutely fine to mention. Again, MCATboss.com if you need to book any a la carte sessions to go over writing that. We can totally talk about that as well. Jansen says, a freshman in college, how big is Spanish as a second language in the medical world? It depends on where you are in the country. If you are in a coastal area where a lot of the patient population may be Spanish speakers. If you are in the South, there are lots and lots of hospitals where Spanish is an extremely helpful language in the emergency room, in the OR, in the clinic. It can be extremely useful. Next one says, I have 4 months to study full-time for my MCAT. Took my diagnostic yesterday, got a 490. Is 515 possible? Okay, the answer to that is going to be way too long for tonight because we are about to wrap up. Please do drop me a line, mcatboss.com, and I'm happy to help. But the super, super, super short version of the answer is that it depends on how you use those 4 months. I have very strong opinions about what you should do for the first 3 months, and I'm happy to kind of walk you through that if that's something you want to talk about. Taylor says, when being interviewed for med school, do you think they will judge you on anxiousness? I feel like I'll be nervous and struggle to answer their questions. So the feeling of being nervous, I think, is pretty normal. The amount that it impacts a student's ability to perform during interviews can be something that can actually change the trajectory of where you're accepted. And I wish I could sugarcoat that. I think it's more useful to tell students, you have to be able to formulate answers. You have to be able to speak in complete sentences, to make eye contact, to avoid using filler words like and ah, to give yourself a reasonable pause to think about an answer, but not an extremely long pause, to come up with examples if you're asked to that are appropriate to the situation. There's a lot that you can do to prepare. If that is something that you need to prepare with family, prepare with friends, prepare with a professional like myself or somebody else, but get the nervousness taken care of beforehand so you don't have the experience of being prompted with a question and then deer in the headlights and because you never know what your interviewer will assume about you if you do have a deer in the headlights because of anxiety. They may be charitable and not think it's a big deal and be like, you know what, take a minute. We're here. Just let us know when you think of an answer. Or they may think this person, their elevator doesn't go to the top floor. You don't know where they're going to land on that. Okay. Dalvin says, how do you balance MCAT studying and a full-time job? So that actually is what I did. I was working full-time when I took mine. Part of it is you take longer, right? You give yourself 9 or 10 months instead of doing it all in 3 or 4 months. But you do not let yourself off the hook for doing a few thousand practice problems and a bunch of practice exams. Do you think patient care tech is good clinical experience? Yes, provided that you also do a variety of physician shadowing and not just getting all of your sort of takeaways just from that. Jay says, I'm a current RN, don't want to go through all the retakes to bring my science GPA up. Thoughts on the Caribbean, Southern specific. I don't actually think that Caribbean is a bad idea at all. I actually think that it's quite, I think if you have an acceptance to a Caribbean school, I don't think there's anything wrong with that at all. As long as you get the clinical placement, the clinical rotation you want later, and that's really the thing you have to iron out, I don't think there's anything wrong with that. And for people who are like, you know what, I'd rather work really hard on my step exams and do the Caribbean route, then I don't think there's anything wrong with that. Adam says, why are we moving? You know what, guys, I normally don't answer questions like that, and I actually am going to. I do not know what this, I'm not great with the TikTok live studio. But this thing of this like action cam thing where it's like, it follows you, and moves around. If you know how to turn that off, please do feel free to let me know. I guess I feel a little bit like an idiot for not knowing how to turn that off. But if you know how to turn that off, then let me know, and I'm happy to turn that off. So there's a little bit less of the moving. All right. New York says, I don't know who that is. Next one says, I have interviews coming up. Is facial hair looked down upon? I don't think it is. I hope it's not. I don't know. I guess I don't have a whole heck of a lot of facial hair, but I mean, I interviewed with, I guess I interviewed with a clean shave, but I think a lot of people I've interviewed with, did, have varying degrees of, everything from the 5 o'clock shadow to the full on, beard. So, yeah. All right, guys, I think it looks like we're close to the bottom of the question. So I'll give everybody like 30 more seconds to drop any other questions in. Otherwise, drop me a line at mcatboss.com if I can help you out. Jake got one more question in. Everyone is telling me to shave, but I have way more confidence with my facial hair. You know what? Own the facial hair. I don't think it's a big deal. If anything, you show up in if you're doing a virtual interview, make sure that you're properly lit. So you make sure you're, bright-eyed and making eye contact with the camera, even if it is a little bit weird, all of that. Adam, I'm sorry, I'm not entirely sure what that means. If that's a short key for how to turn that feature off, you might have to give me more. Okay. Anyway. All right. But yeah, no. Oh, yeah. So I would say worry more about your lighting and your microphone or your earbuds or whatever you're going to wear. And having a nice, if you're doing an interview, like wear the same suit you would in person so that you look like you prepared for your interview. And, otherwise, I mean, I cannot imagine it being a downside to have facial hair, but maybe I'm wrong. I don't know. I'll have to now see if there's any psychological surveys on that. Adam says, I've been hearing some Caribbean medical schools are losing accreditation. I mean, that can happen with any med school technically. Definitely. That is worth thinking about. If you're at a school or if you're applying to a school in the Caribbean and they have a history of not keeping their accreditation, that would definitely be, for me, that would be like a rule out, right? All right, guys, let's go ahead and wrap it up there. Thank you for joining us. Go ahead and part ways on the YouTube.